October is designated as the Breast Health Awareness Month, and it's huge because this is a disease that affects 1 in 8 women in the United States, and once it affects the woman with cancer, it affects millions others with their families and what have you. So October is the month dedicated to education. It's dedicated to the professionals getting out on the deck plate per se, and making sure people are aware of what their responsibilities are for their personal health.
Well, there's a couple different guidelines that have come out as far as when you should be seen, the age, and how you are seen at the hospital. So the different guidelines are the American College of Radiology. They recommend starting screening mammograms at 40. And then the other side of the house is the U.S. Preventative Service Task Force. They recommend screenings every 2 years starting at 50. So the most important thing that we ask patients is to set up an initial appointment with your provider and discuss the different guidelines, basically, and kind of discuss what works for you based on risk factors and just the overall comfort of the patient. So if a patient does want to come in for a screening mammogram, we ask that they go see their provider, and then they can just call us and make an appointment. After that initial appointment with their provider, they can do what we call self-referral every year and see us. They just call radiology, they say, I want a screening mammogram, and we schedule them. The only caveat to that is if they are having breast concerns, then we ask them to see their provider first, and then the provider will order the correct exam that the patient needs.
If I can add in on that, one of the things that's very, very helpful, and a lot of patients have found out, is their prior exams, prior films, prior pictures. Every time the patient's able to bring those, whether they're coming from Guam or wherever else, it's extremely helpful if they have them ahead of time, in that it'll sort of cut to the chase of what we're looking for currently, being able to compare with however many years in the past that we can look at. So it's always helpful when patients, it's almost like it makes us all smile that day at the clinic when the patient brings them in with them.
Up on Navy.mil, if you want to read about a personal story, there's a Chief Petty Officer, Jackie Smith. She's actually an MC and does a similar job to, well, same job as what I do. I think in the Navy they actually do a more wide variety, but I digress. She has her own personal story up there, and she's keeping track of it as she goes through her battle with cancer. So definitely check that out on Navy.mil.
Inspiring. It is inspiring. She's a chief. She's agreed to kind of give a reference and a historical background of what's going on with her, and through her fight. And I hope it inspires many people. It's a Chief Jackie Smith. Awesome. Go to the website if you want to get inspired.
I just wanted to remind everybody one last time, 1 week from today, that's next Thursday, October 30th, we will have a Breast Cancer Awareness Month celebration at the hospital. That's going to be on the second floor of the hospital, the first floor of the hospital in the atrium area. Have a cake cutting ceremony. We'll do a little bit of a discussion about breast cancer risks, educate the anybody who is there, of course, a little bit more. Have a guest speaker, and naturally the cake, which will be the most important thing. But that'll be October 30th, next Thursday at noon, and we look forward to seeing all of you there to honor and remember all those whose lives have been touched by breast cancer. I'd like to thank CMC for having us here today, and pass it back to him.
Well, I'll tell you, again, I could not have done this without, like I said, the rock stars that I am very fortunate to have at the hospital, and have an HM1 and Commander Paz over here, the subject matter experts, to get out to the community, to let them know that you own you. You own yourself. So take control of yourself. Take control of your health, and get into Relay Health, and know that we have some experts at the hospital that care about you, that want to make sure that you're doing the right things, and that they're doing the right things to put you on the right track. Live with honor, fight with courage, and always be committed to excellence.